So I'm getting my patient's chart ready before she goes into surgery. I am going through the chart. So she's having surgery, and I need to make sure that she signs the waiver consent form that if she loses blood, excessive blood, and she needs a blood transfusion, and I need her consent that she does want blood to be infused or she be treated with that, or if she denies of having a blood transfusion. That's a waiver that needs to be done. I need to make sure that it's done before the procedure, because I cannot give this consent after the procedure, because what if the patient has the transfusion and she didn't want to, she didn't accept it, and they did it, we can be in big trouble for not giving this type of form to her before. And as well, when she's in a stable mind of condition where she's aware of what she's signing, we cannot give this form when she's not when she's not aware of what she'll be signing. Another type of form is if you want to lease, if a patient has another person making medical decisions for them, you have to give them the release. You have to give them a waiver form of the living will, so you can have that in hand and make sure that you can release information to the person that is not the patient. It's not allowed to release any type of information to anyone, other if you have that waiver, that it's basically a document saying you're authorizing to release this information to this other person. And that's how you basically give the waiver or the consent to the patient. It's basically a written paper with that consent, and it has to be signed by the patient.